And the reality is that we've had over a decade where there have been sporadic cases like myself coming to the US with Ebola, but we haven't had big outbreaks. We haven't had more cases. And that's because we put in place the systems to detect where Ebola is occurring, to go to countries like Uganda and Congo and others that are home to frequent outbreaks, to support them, to give them training to diagnose and to treat. And this has been remarkably successful for a pretty damn small cost.
This is Dr. Chethan Sathya. Thank you for joining us for this episode of Northwell Health's 20-Minute Health Talk. Today, we are honored to be joined by a good friend of mine and colleague, Dr. Craig Spencer. He is an emergency medicine physician, a true public health leader, and a public health professor at Brown University. Dr. Spencer, thank you so much for joining us today.
Really excited to be on with you today. I'm loving to continue the conversation that we've been having really over the past couple of months and the past couple of years about what's happening in health and in public health and how we're both trying to meet this moment.
Well, you're doing and have been doing such incredible work across public health and have such a unique background. I will say, funny story, right, is the way that we met. Just for listeners to know, kind of the first time Craig and I met was in a European airport. And we then proceeded to share a train together, share a room together, and never looked back. But it's really been incredible to understand how you think and learn more and more about what you do. Let's start very early on, right? What inspired you to become a physician in the first place?
It's a good question. I wanted to be like you, although I wanted to be a cardiothoracic surgeon, but my whole goal was I was going to be a surgeon. And that's after my life was destroyed. When growing up, I was like, I'm going to be a sharkologist. I'm going to study sharks. I'm going to know everything about sharks. To this day, I know all the differences between different sharks. My 5-year-old thinks I'm, a wizard. But I was like 9 or 10 years old, and someone said, "Oh no, you can't be a sharkologist. That doesn't exist. You have to be a marine biologist and study plankton and algae." And I had absolutely no interest in that. And so I was looking for another job. And it was back during the days of microfiche, which I'm guessing about 80% of your listeners won't know what that is. So it's kind of like the pre-internet. You would look under these little things under this big light. And I was looking at these different professions for social studies class. And I saw that a cardiothoracic surgeon made the most money of any profession. So I said, I'm going to do that. And I committed my life to being a cardiothoracic surgeon. I knew everything about EKGs. I could tell you everything about the heart as a 12-year-old. I was playing hockey when I was like 12 or 13 and had a C7 fracture, was in the hospital, and I'm looking up at the monitor telling the ER doctor about, the QA or the S and the T waves. And she's just like, what is wrong with this child? And so I went to med school to be a cardiothoracic surgeon. I went in, like that was the goal. I was going to make a bunch of money. And I ended up during the first kind of summer break that we had, one of my friends said, "Hey, we're going as part of this World Health Student Organization trip down to the Dominican Republic. You should come. You got nothing else going on." And so I went down and I immediately recognized that what the world needs is not another cardiothoracic surgeon, but someone capable of doing just about anybody for anyone, anywhere. And I also then, kind of went into my cardiothoracic surgery month. Still unsure of what I was going to do. And I'll tell you, the first day that I had in my surgery month was just absolutely horrible. It was like the worst day of my medical career. I stood for 14 hours over this nasty aneurysm. I was like, this is not what I want to do with my life. And so I know this excites you, but I'm sitting there and I'm thinking, man, like this can't be my life. And so I got up and I moved to China for a year, quit medical school, moved to China to figure out what I wanted to do with my life. And came back convinced that I wanted to work in a very international environment. And so I did my residency in Flushing, Queens, and decided on emergency medicine because I wanted to be able to treat anyone for anything, anywhere in the world. And so that's my very complicated story from sharkologist to ER doc, speaking Mandarin to patients out in Flushing.
Wow. So Shark Week's a big thing at home.
Shark Week's a massive thing at home. I mean, look, my 5-year-old has this thing where he is down with sharks, any living animals, but unlike other 5-year-olds, absolutely no extinct animals. Dinosaurs, he doesn't care about. Shark Week is huge. Both of my kids
I
are
love it.
super into it. So they're following in the path. Maybe one of them may be a marine biologist and follow my original path, but we'll see how that plays
Yeah.
out.
Or maybe a surgeon, right?
Or maybe
You
last
know, you
night
never.
my daughter was like, "Look, Dad, I want to be a zoologist or a veterinarian, but I know that when I'm older, I'm going to be a doctor." And that's the first time that she ever said that. She's 7. We'll see how it all plays out.
Wow. I did not know, in all our conversations, you always learn something, right? I mean, I didn't know that you wanted to be a cardiothoracic surgeon. I mean, you always say that
Yeah.
I'm one of the few surgeons you can hang out with. So I didn't know you actually wanted to do
Yeah,
that.
yeah,
That's amazing.
it was in my bones. That was the goal. Yeah, that's why we had a good connection, obviously.
Incredible. So listen, there's so much we could cover. You've had such an
Yeah,
incredible career thus far and are going to be doing so much more in the years to come. You've traveled to so many different places. Let's start with one of the biggest stories, right? And probably kind of a pivotal moment in your career
yeah.
is the Ebola crisis. So
Mhm.
walk us through, what that experience was like, right? You were there in Africa, right? As the Ebola
Yeah,
crisis and pandemic was starting.
yeah. I was actually in Congo, Democratic Republic of Congo, working on a project in 2014. And I had a friend of mine that was working with Doctors Without Borders right when the Ebola outbreak was first notified in March of 2014. And I remember saying to him, I don't know what you're doing, man. You're crazy. People normally run away from stuff like that, and you're running towards it. And this has been a friend of mine since we were, in our early teens. Um, and it was a couple months later, he had already gone, come back, went back again. And then I realized, man, Craig, if you're not responding now as someone that feels comfortable in these contexts, that's worked with infectious diseases in the past, that wants to work in global health, then like who is responding? Because at that point, Guinea, Liberia, and Sierra Leone, the 3 countries that were hit the hardest by the Ebola outbreak in 2014 to 2016, they had fewer physicians in all 3 countries combined than in, the one hospital that you work at, for example. And I realized that we needed a huge international response, not just to stem the tide and prevent Ebola from showing up in the US or in other countries, but to provide the type of care that people deserved in their own communities, in those hospitals, in those clinics, in those Ebola treatment centers. So in September, I went to Gekadu, Guinea, which was the epicenter of the outbreak. That's where the first cases were reported in late 2013, 2014, when they were, kind of first detected in March. And I showed up to a city that seemed relatively normal, except you could see that no one was really touching. Um, I then went to our Ebola treatment center and saw, the apocalypse, right? You would go in the morning and you would talk to patients that seemed fine, and then you would come back in the afternoon to give them their meds, and they'd be dead. Even with some of the interventions that we were able to offer, this is before vaccines, before any Ebola treatments existed, we were able to drive down mortality a bit. So IV fluids, antipyretics, for fever, for vomiting, to replace fluid losses. We were able to drive down mortality a couple dozen percent, which is pretty incredible. But the problem is that it was a couple dozen percent from like 80 to 70% of all people dying to like 40 to 50. And that was tough. It
Yeah.
was tough for me, but quite frankly, I was there for 6 weeks. The people I was working with had been there for 6 months, had been working every single day. And there were days that I threatened to not come to work if one of my colleagues did not take the day off because they had been going at it for so long.
Wow.
And I had the luxury of coming in for a short period of time, learning an incredible amount from these folks, and then going back home to the US. These were people that were dealing with this every day and then dealing with sick family members at the end of the day whose communities were being destroyed. And in terms of, moments in your life, your professional life and your personal life that are truly cataclysmic, I can think of none that is more so for me. And that's before even I got back to the US, started feeling unwell, and was confirmed as New York City's first and thankfully last Ebola patient in October of 2014.
I I can't imagine what it was like for you and everyone going through that overseas. Were you scared?
Oh, yeah, every single day, right?
Yeah.
Yeah, of course. Yeah, every single day. Every single day. I had never experienced it. We can't imagine. It's impossible to imagine a scenario where you fear for your life just by doing the job that you're doing, but you also recognize the importance and really the necessity of you and others to be doing that job, right?
Hmm.
You don't do it, and then not only does the epidemic get worse, we can talk about it from an epidemiologic perspective, but what about from an empathy perspective? What does it look like to not provide that care that we're capable of delivering to folks who need it truly more than anybody in the world?
Yeah.
And yeah, it was tough. I learned a lot. The team that I worked with was unbelievable and supportive. And so, yeah, you'd get up every day afraid of the day ahead. You'd go into work, you'd take care of people, and in that process of doffing, taking all that personal protective equipment off, it was almost like you were kind of washing off the weight of that worry, not knowing whether you were infected in that process, hoping that you weren't, following protocols. Um, but there's something about washing away all of that worry in the process of taking care of people. And yeah, it was tough. I mean, it was tough. It was tough. And then nothing can prepare you for it. But in many ways, it prepared me for an unexpected crisis that we would see in our own city in New York in 2020, just a few years later.
Yeah. Yeah. No, I was going to ask you about that. And we certainly will shift to more domestic public health
Yeah.
shortly. I remember, but both of us were in New York, right, during the peak of the COVID-19 pandemic.
Oh, yeah. Yeah.
And, walking those streets, right, everyone clapping, but just the fear going into the hospital, not knowing. I mean, I can only
Totally.
imagine that what you experienced with Ebola was even that much more scary. And the folks there, I mean, what was the ambiance like? You mentioned people weren't touching each other, right? But I can imagine
Right.
the fear was tremendous, and potentially the stigma.
The fear was absolutely tremendous. But even then, like, if you think about how many cases there were over the, 2+ years of the outbreak, we're talking 27,000, 28,000 recorded cases. The number is probably much higher. But still, at 27, 28,000 cases across 3 countries, that's a lot. It's the biggest Ebola outbreak ever. But, there were weeks where we were having, or even days that we were having kind of more cases of COVID in the US. And so this was stretched. It's hard to kind of have any comparison truly between the experience of being in a place and particularly in Gekadu, Guinea, which at that point, by the time I was there, had already been dealing with Ebola for months.
Mm.
And, I've worked in war zones. I've worked in places of conflict where I had lived before during peace. And I remember just how like eerily similar things felt, even in the middle of civil conflict. In Bujumbura, for example, the capital of Burundi. I lived there for a year, went back during conflict, and things felt similar. The structures were the same, the people were the same, but there was this uneasiness in the air. And that felt the same in Guinea, right? Like everybody knew that their risk was still pretty small, but the repercussions were massive. And so, you did see people doing what people do everywhere, right? You weren't supposed to be touching, but there were people walking down the street hand in hand, lovers, whatever. And so you see humanity in the midst of one of these outbreaks. And at the same time, you drive past this as you're going into an Ebola treatment center, realizing that you're about to see the most kind of inhumanity of what a lot of folks had to deal with. And even with the quality of care that we were able to provide, we were there. We were providers. We were able to provide medications, and we had people. It was nothing like what I received in New York City, right? The quality of care was just like logarithmically different. And I am unbelievably grateful for the care that I received at Bellevue. I'm here because of it. But there were times where I was taking care of probably 30 patients at a time in Guinea, and I suspect there were probably 30 people either taking care of me or on call to take care of me at any moment during my hospitalization in October and November of 2014. So you can't have this moment where you go somewhere and just see the inadequacy and the inequities of access to care and then come home and be in that position yourself and be grateful for what you got, but also not be able to see that disparity
Hmm.
and then think about that disparity magnified over and over in outbreaks all around the world for many, many years and thinking about what do we need to do different to make sure this never happens again.
Well said. Well said. Yeah, I mean that must have been such a striking comparison, right? To kind of see the care that you were getting versus
Yeah.
what you were having to deal with there. But you must have been tremendously also fearful when you were kind of diagnosed with having Ebola as well here in New York, right? What was going through your mind, and in addition to everything you mentioned?
Yeah, it's been a while, but I know that I wrote about this and I try to think back and try not to create memories, but I do distinctly recall that fear, that omnipresent, kind of ever-present fear of was today the day that I was infected, and that being with you in your body, deep inside you every single day that you're taking care of people. And obviously, you don't want to get Ebola. I don't recommend it. Even now with vaccines and with treatments, there's still a high mortality. Um, but when I went to the hospital and I had diligently taken my anti-malarials, I had received all my vaccines, like it was pretty clear that this was the most likely source. And once, my provider sat on my bed next to me and said, the preliminary test had come back and it's positive for Ebola. There's obviously that fear, right? Knowing what you saw, what I just saw over the past, month and a half, and for how many people that similar diagnosis that I gave was a death sentence.
Yeah.
But for a brief moment, it was almost like, okay, that weight of my worry is over. I don't have to worry anymore. I don't have to worry about whether or not I have this. I do. And so now what do I do?
Yeah.
It was a very, very just like really strange, surreal experience, if even for a few seconds before we got down to the next work of like, okay, what do we do now to increase the likelihood that I'm going to survive?
I can't imagine. But clearly, you recovered from that, and your resolve to tackle a lot of these big issues only increased.
Yeah,
Um,
I mean, I was in the hospital in November of 2014, and I got out of the hospital. I had a hard time walking, lost a bunch of weight, lost a bunch of hair, all the things that happen after really severe illnesses, ICU syndrome, etc. But I was resolved to do better. I also was lucky to be, at baseline healthy and young. And a year later, November of 2015, I ran the New York City Marathon. And that for me was like a really big thing to do, to know that I had kind of moved past this, but also to kind of set a challenge for myself to do something similar in things like access to medicines, things like talking about inequities, trying to raise the bar for myself and showing that it was possible.
it's outstanding, outstanding. So, Craig, through your experiences, let me, again, right now we'll focus a little bit more on global health, but there's a lot of narrative out there right now, right? Should Americans, the West, be supporting kind of the global health of many other countries, right? When we have
Mhm.
so many problems here, for example, poor health outcomes, right?
Yeah.
Maternal mortality and so on. You know, what should those investments look like and why? And of course, we've all been watching the news on the World Health Organization and changes there
Yeah.
geopolitically, investments reducing. What would you say to folks when they ask that question?
I think there's two ways to respond to that. There's a pragmatic response and there's a philosophical response. And let's start with the pragmatic one. Um, I think there are two bipartisan things in this country right now in a time of intense political division. One is nearly everyone loves ice cream. Two is a like deathly fear of Ebola. Democrats and Republicans, when Elon Musk, just over a year ago came out and said, oops, I accidentally slashed Ebola funding, but we put it back in place. Like there was bipartisan ridicule and anger. Everyone's afraid of Ebola. And the reality is that we've had over a decade where there have been sporadic cases like myself coming to the US with Ebola, but we haven't had big outbreaks. We haven't had more cases. And that's because we've put in place the systems to detect where Ebola is occurring, to go to countries like Uganda and Congo and others that are home to frequent outbreaks, to support them, to give them training to diagnose and to treat. And this has been remarkably successful for a pretty damn small cost. The return on investment of us going to places and helping build surveillance systems so they can detect Ebola and keep it contained has been amazing. Let me give you a couple examples. So, over the past decade, there have been a handful of Ebola outbreaks more. Places like Uganda that have a lot of experience, the U.S. has gone in, has helped via USAID move samples around the country, to provide reagents, to set up airport screening at the airport in Entebbe or wherever an outbreak may be, so that people getting on that plane don't have a fever and are not going to show up in the US or Europe or in other places with Ebola. That's amazing. What also is amazing is you think about a place like Rwanda, and when you mention Rwanda, the overwhelming majority of people are going to think of the genocide, right? That is the thing in most Americans' consciousness from 30 years ago, Hotel Rwanda. 30 years ago, Rwanda had no public health infrastructure, none,
Wow.
right? 30 years later, there was an outbreak of Marburg virus disease, almost the exact same virus, same symptoms as Ebola, just as scary, just as deadly. There was an outbreak detected in Kigali, the capital of Rwanda. Immediately, the Kigali Ministry of Health and a bunch of other folks jumped on top of this outbreak. They stamped it out in an incredibly short period of time and in a very efficient way. They worked with the global community, including pharmaceutical companies here in the United States, to get investigational treatments, including monoclonal antibodies and vaccines, into Rwanda just over a week, about a week after the outbreak was declared. And the result was that Rwanda, which did not have a health system 3 decades ago, was able to lead a response to Marburg virus disease, an outbreak, that had the lowest mortality ever recorded in history. Unbelievable work. And that was done in Rwanda by Rwandans who had over the years received support primarily from the US, right? And building up health infrastructure, on medical training, on diagnosis, on reagents, all the things that the US has done for a really long time in supporting global health. This was a success story. The problem is that nobody heard about it.
Yeah.
It wasn't splashed on the front page of the New York Times. New York City doctor has Ebola, right? And so the investments didn't go on. People didn't realize that the ROI there was amazing. We need more stories like that, the near misses or the success stories. Now, that's the pragmatic response, is that we need surveillance systems around the world so that scary diseases do not get on a plane and come to your house, or that they do not come and overwhelm hospitals that your grandma might need her cath at, and they have to close down because of some scary infectious disease. Like, that's the pragmatic response. Now, the philosophical response is, I just think we have a responsibility to do this.
Of course.
We not only have the resources, right? We have a bunch of money, we have a bunch of expertise. There has long been this phrase, misattributed, but attributed to Alexis de Tocqueville, the famous observer of early America, said America is great because America is good. And when it stops being good, it stops being great. I think that's true. I think that the United States has led the way for a really long time, not only setting up surveillance systems in places like Rwanda, but showing the way that we can be committed in resources, but also just like in empathy, right? And the thing that defines us as a country of being good, to go to other places to help them, to make sure their systems are safe, their people are safe. There's a pragmatic reason for that, but there's also just the fact that we're good. And I want us to recognize that that is the best version of ourselves, that we can do these things pragmatically to keep ourselves safe, but that going abroad, helping organizations like Doctors Without Borders or USAID or Samaritan's Purse or whoever else it may be that's doing this work, helping them do their mission makes people safer, but also just like makes us better. And instead of us always focusing on what the other side is doing wrong, let's take this moment to talk about what we can do better. Yes. Recognize where we have our own shortfalls and our own pitfalls and address those issues. Because if we want to, quote, be back in power in 3 years with a different administration, whether it's a Democrat or Republican, whomever it is, that's going to re-envision health in, quote, the old way that we used to do it. Like, it's not going to fly unless we prove willing to truly question the problems that got us here in the first place. And I think that's what RFK Jr., for better or worse, for a lot of people, that's exactly what he's done. He's asked a lot of questions that many of us have put off for a really long time, and he's getting to posit the solutions that many of us unfortunately disagree with.
When it comes to World Health Organization, Craig, there's of course been criticism as well, right?
Yeah.
Do you think that there are reforms that are needed or ways that that organization could be more efficient? Like, is some of this warranted as well to have a relook there?
Yeah, for sure. Look, I think if you ask anybody at the WHO, they will honestly tell you yes. It's an organization that, at this point is 80 years old. It was set up at the behest and with the support of the United States in the 1940s. Like any organization at that age, like it needs a reset and it needs a rethink. It does not need a demolition.
Mhm.
And unfortunately, what the US has done over the past year in walking away has, you know, not only not paid its bills, stiffed the organization to the tune of hundreds of millions of dollars, but has left it without that kind of multinational kind of mandate to do the work that we need a WHO to do. Look, the US thinks that it can rehash and redo global health in a way under this administration with the American First Global Health Policy, some of which, is actually quite okay and good, and I agree with. But the reality is that we've been shown time and time again, we need multinational agencies that can do this work.
Hmm.
We need organizations that can work across countries to do negotiation, to set protocols. And I think about a decade ago, when the criticism towards the WHO during the Ebola outbreak was that you weren't fast enough, you weren't operational enough, you weren't on the ground, you weren't doing the things that we needed you to do. And there was a massive call for reform to change the organization, to be more operational, to be more active. And a lot of that call came from inside the US. And what's happening now, just a decade later, is that we're saying, actually, no, we want you to do the exact opposite. We're going to take away your money. We're going to take away your resources. We're not even going to allow people from the CDC to even talk to you, which is just, bananas.
Yeah.
And so I think we're not only shortchanging the one organization we really need, even if it needs reform, we're shortchanging ourselves by cutting off access to really good, really wonderful, and dedicated people who do health work all around the world. And anyone who has done anything outside of the US or even in different communities in the US recognizes that if you want to tackle health policy, if you want to tackle an outbreak, if you want to do anything around public health, it needs to be contextualized in that community, in that country. And that having those connections is the most important thing that we can do. Just another example from the surveillance, this justification for why we need this disease detection and these networks and the U.S. support. It was through a WHO supported training that the U.S. helped lead that one of the outbreaks of Marburg virus in Tanzania that was detected last year or the year before. That's how it was detected.
Mm.
So you have the US supporting WHO and WHO trainings to go out and tell community health workers to look for these signs. This is a relationship that has been around for a really long time, that has made us all stronger, that needs some reform, but the last thing we need to do is get rid of it. And I think that this is going to be a really unfortunate and really stupid own goal by the US.
Very eloquently said. I mean, need for reform is there, right? Things could be better, but you can't do that if you just cut off collaboration and just totally slash
Absolutely
all the
not.
infrastructure
Yeah.
behind that. And
Yeah, you can't just,
that's just common sense.
yeah,
Um, I love that. So shifting domestically,
yeah.
The COVID-19 pandemic, as you've already mentioned, right, was a kind of critical moment when it comes to public health in this country and
Mhm.
and arguably globally. We're at a interesting time right now with trust when it comes to public health, and we can look back on the COVID-19 pandemic and talk about what worked and what didn't,
Yeah.
and we also need to look forward and what is that
Right.
pathway forward. So maybe I'll just kick us off when it comes to the COVID-19 pandemic. I mean, what do you think we got right and what did we get wrong?
Man, that is such a good question. I wish that we had an official, investigation into this as a country.
Yes.
Unfortunately, we don't have that. Wouldn't that be amazing, right? Like we
That
have some
would.
report. Unfortunately, we're incapable of doing that because our divisions have been, I think, made so deeply that even on the most obvious things we should agree on, we can't. Like you and I were both working in New York City. We saw the worst of the worst. I was in Manhattan. There were days where I saw more people die of COVID-19 than I did of Ebola when I was there in 2014. It was apocalyptic. I remember walking in to the emergency room and just kind of standing on the brink of the ambulance bay and looking into like a sea of people on ventilators and just noises and beeps and sounds and drips and just like not believing that this was possible, particularly in like one of the richest cities and in one of the best hospitals in the whole world.
Hmm.
And, I've come to recognize that my own experience in March and in April of 2020, in a sense, clouded my own vision for the next few months, thinking about what would happen around the rest of the country, what we weren't prepared for. And it seemed like any intervention that we could take that would prevent what we had to experience in New York City was going to be worth the squeeze. And it's hard to argue the counterfactual. Maybe things would have been different. But what we do know is that, like, man, despite how we remember it 5 or 6 years later, COVID was catastrophic.
It
We
was.
lost over 1 million people. Excess mortality was just massive. And that's despite us having the best case scenario where within really just months, we were able to get a vaccine that helped save millions of lives. And I spend so much time, as I know you do, as I know we do, talking together about thinking about what I call, hindsight is March 2020. Everything seems so much clearer, right? Like, why didn't we just do this in March 2020? Why didn't we just say this? Why didn't we just do this about this and this? Like, it seems so clear in retrospect. But the reality is that we were working forward. We were working in prospect. We were trying to figure out, kind of at the moment, what was happening, and walking out of the hospital and seeing morgue trucks, and then to this day having people, argue with me about how things weren't that bad.
Yeah.
We're still at this incredible disconnect between what we all experienced, what we all agree happened, and what we all disagree on could have been the best way forward. What do I think we got right? Look, I remember getting lambasted kind of early on for saying that Operation Warp Speed was one of the most incredible
Hmm.
biomedical projects we witnessed in our lifetime.
Yep.
Absolutely incredible,
Agreed.
right? And people, pointed fingers at me and said, "How dare you support this president who, didn't do anything to stand up a sufficient response?" And I said, "Look, these things can be separate things.
Yeah.
I think our response in March, April 2020, particularly at the federal level, was egregious and was horrible. But Operation Warp Speed saved millions of lives, and I'm incredibly grateful for that." I think that despite how lambasted the public health community is for, what is seen as kind of wishy-washy communications, et cetera. I think even if we had every single public health professional that was as gifted a communicator as you, I still think we would have been in a really tough spot because, quite frankly, people don't experience public health in their daily lives.
Yeah.
They do, they just don't know it.
Yeah.
There's a reason that all these TV shows about health are about doctors. They're about people like you, pediatric trauma surgeons saving lives. Like, that is such a wonderful story. But as you and I both know, more lives are saved on a daily basis than
Public health.
whatever you and I can do in the emergency room or the operating room by people that are putting in place and verifying and checking and ensuring that public health systems remain. And for so long, those systems have been invisible. Public health has said, we want them to be invisible for reasons I don't fully understand. And so what happens is in March or in April 2020, you have this public health community that shows
Hmm.
up. And to many people feels like, it only comes up to wag its finger to tell you all the things that you're doing wrong, as opposed to all the things that it's been doing right. And I think that was a misstep for us 6 years ago. I think it's a potential misstep for us now if we look towards the future and say public health is just going to slink into the background again, particularly now that the field is under a lot of pressure and people are coming at it with pitchforks. But I want public health to take the same space up in the American imagination as health does, right? As medicine does, as people like you do, because we need to not only trust in and support, but believe in the capabilities of those professionals. And I think the last couple of years in the COVID pandemic really put a big dent in that, but I'm not convinced that we can't give it back if we do it in the right way.
That's so true. I'm just reflecting on the way that you phrase that, right? I mean, public health work has been like that invisible shield
Yeah,
for so long, and whether you're talking about pandemics, clean water, sanitation, rats, right? These are all things that actually go into public
yeah,
health, and I think people assume that you're right, and they don't necessarily equate it to individual health. But the way that you reframed that was incredible. Um,
Yeah.
yeah, and you also mentioned we can agree on certain nuances of a topic and disagree on others, right? I mean,
Totally.
we have to. I think you're right. I mean, as a public health field, have to be more comfortable expressing where we agree and where we disagree, even if it doesn't mean we're supporting everything, right? I mean,
Yeah.
we could have debates out all day long on school lockdowns and maskings
Right.
and wanting to do
Totally.
things differently. Of course, I think we dug our heels in a lot there and we're overly
Yeah.
dogmatic, right? And
Yeah.
I know you're doing a lot of work to kind of bridge that gap now and to rebuild that trust. But I do think at the end of the day, we also lacked empathy at times, right? Because
Mhm.
we were also very scared and went through that
For
horrific
sure.
trauma. But
Yeah.
I talk about the story commonly. I mean, I used to remember walking on the street and thinking about the restaurants that were closed or the shawarma trucks that weren't there anymore
Totally.
and those
Yeah.
families, right, who didn't have a job and the economic impact there. And so, you know, not to rehash COVID, right, but looking forward,
Yeah.
something seems like it needs to change because all I feel is like we're getting more and more siloed on both sides, arguably, right?
Totally.
Fewer people are like you wanting to have that conversation that's bridging divides and saying, listen, like evidence shows this. We shouldn't ever accept false equivalency, right? Let one small study
Yeah.
rise to the level of thousands of meta-analyses. No one's saying that. But how do we have a constructive conversation where when the next pandemic comes, right, we've built enough empathy and trust that we can actually consider some of these not unreasonable things?
Yeah. I think we do that by having a constructive conversation. Look, you've been doing this work, you've been doing it along with me. I see you, pop up at these events that, quite frankly, our ilk otherwise aren't showing up to. And it's not necessarily because we're bought into everything that's being said at the Maha Institute, for example, but we recognize that this not only has power, but it has, a big place in the imagination of a big chunk of the American electorate. There are a lot of people, by some estimates, 45% of Americans are bought into Maha, are supporters, or are incredibly curious about. Um, I know you and I recognize that what we've been doing, or even what many of us think is the way forward, which is, hey, we just need better data and we need to start with the evidence and we need to double and triple down on that. And we need to show people that the numbers don't lie. And if only we can have these peer-reviewed journals that show us that the gold standard science we're doing versus the gold standard science that they're saying they're doing, that's wrong, like we'll come out on top here. And I teach a class on the historical determinants of public health, and I talk about the history of the anti-vaccine movement. And what I say to my students is talking to the anti-vaccine movement should be the easiest thing in the world because the anti-vaccine movement has not changed its argument since the early
So true.
1800s after the first vaccine.
So true.
The pictures of, kids being fed into a cow and coming out the other side with horns on their head, like it's the same argument about vaccines changing your DNA. It's the exact same. The arguments are the exact same. The problem is the public health community is arguing in the exact same way as it has for a couple hundred years. And we keep saying one more graph, one more data point. I show them this picture from an outbreak of smallpox 100 years ago that shows on the top convincing facts exclamation point, and then talks about the number of people in the hospital, the number vaccinated versus the number unvaccinated, as if it should be clear to anyone with basic numeracy that getting vaccinated is the right thing to do. That hasn't worked. It's not going to work 100 years from now. What does work is talking to people, just straight talking to people. And I think we assume that we have a foundation upon which we can start rebuilding trust right now. That, what, we were wrong. We need to have contrition. We should have done better about masking. You're right. Maybe we should have kids back in school earlier. Maybe we should have, some role for religious exemptions or no role for religious exemptions with vaccines. I think there's many of us in our community in public health and in medicine and elsewhere that think that we've built that foundation upon which we can rebuild back trust. And I am increasingly convinced in the conversations that I have with people in Maha, showing up at the Children's Health Defense anti-vaccine, like rabidly, in their own words, anti-vaccine conference. The conversations I have with normal people in Christian coffee houses in like rural Ohio, is that foundation we think that we have where we start to rebuild that trust does not exist.
Yeah.
That we need to go down one further level. And this isn't like a meta-analysis. This isn't a peer-reviewed randomized control trial. This is like going and talking to people. Something that we're willing and seemingly incapable of doing in an era of social, social media and, concerns about mis and disinformation and these different bubbles. I'm less convinced that that's the problem. I'm more convinced that we've created that as a scapegoat for the real hard work, which is talking to people.
I love that. I love that. I mean, I know I agree, because when you do talk to people, you realize why they feel a certain way as well, right? Which is important.
Yeah,
I mean, because the stats all day long, right? Unless you understand and resonate with it, it's just like any patient-doctor relationship. You have to build a relationship with somebody, right? They have to
yeah,
trust you for a reason. And I think,
totally.
the work you've been doing around that is incredible. And yeah, that last Maha kind of conference we went to, I found it really interesting, the conversations we had with folks, but
Yeah.
also, I know we both wrote about this, but it was an NIH focused reform
Hmm.
panel, right, with Dr. Jay Bhattacharya and others, but also hosted by the Maha Institute. But everybody in that room, very different opinions coming to Maha with,
Yep.
they're not a monolith, right? Doesn't mean everyone's an anti-vaxxer, but
Yep.
yeah, of course we met folks, and I met folks that I would say had opinions that I just totally disagree with, and were
Totally.
quite out there. But the amount that they supported everything that was being said on stage from the NIH agency heads, many of which have spread and spanned multiple administrations, are incredibly
Yep.
accomplished, right? Like
Yep.
the NCI director and so on,
Totally.
um, was outstanding. And those are reforms I actually all believe in, right?
Totally. Yep.
Reforming peer
Yeah. Your
review,
piece
being
was
more
great on
efficient.
this. Exactly. I
Yeah,
completely agree.
yeah,
Yep.
decreasing bias. And that I found interesting. So somehow that whole group totally bought into a lot of NIH reforms that I think many of us would agree with, right?
Yeah.
Funding
Yeah.
cuts aside. Um, that's fascinating, right?
It's incredibly fascinating.
Yeah.
Look, and this is what I keep saying to people is that we can have a knee-jerk aversion to anything that comes out of the mouth of Jay Bhattacharya or RFK Jr. or whomever is your boogeyman at this moment. And that is not to say that there are not things that they and others say that I don't completely disagree with. There's a
Yep.
lot of things that I completely disagree with, right?
Yep.
But my wife and I disagree with a lot of stuff too, and we've been married for over a decade and together for 20 years.
Yep.
It still works. That's okay. We can have disagreement. I do think that there are places where, and I've written about this, I've talked about this. I think we spend so much time with our knee-jerk aversion to anything that comes out of the mouth of people that we don't agree with, particularly in this administration and in health, that we spend less time looking at the actual accusations lobbed against us.
Yep.
And the thing that I keep coming back to is that very few of our community recognize how much this idea of medical societies and American medicine and health as being bought by corporate capture, how much that resonates with average Americans. And RFK Jr. says this all the time. He posts about it on his Twitter page that the American Academy of Pediatrics is bought by the pharma industry, and how can they be recommending for you the right kid vaccines if they're bought by the pharmaceutical companies? Now, do I think that AAP and other organizations are, bought part and parcel by pharma companies? No. Do I think that having the majority of donors for an organization like AAP and actually every single other large American medical society that represents the overwhelming majority of American doctors, do I think it's problematic that on all of their donor pages, Pfizer and Amgen and Eli Lilly and all these other pharmaceutical companies are listed as 50,000, 100,000, 500,000, 1 million plus donors? Yeah, I think that's problematic. I think that's something that we as a community need to look into and say, even if this does not create a conflict of interest, it creates the appearance of a conflict of interest. And instead of us always focusing on what the other side is doing wrong, let's take this moment to talk about what we can do better.
Yes.
Recognize where we have our own shortfalls and our own pitfalls and address those issues. Because if we want to, quote, be back in power in 3 years with a different administration, whether it's a Democrat or Republican, whomever it is, that's going to re-envision health in, quote, the old way that we used to do it. Like, it's not going to fly unless we prove willing to truly question the problems that got us here in the first place. And I think that's what RFK Jr., for better or worse, for a lot of people, that's exactly what he's done. He's asked a lot of questions that many of us have put off for a really long time, and he's getting to posit the solutions that many of us unfortunately disagree with.
I could not agree more, Craig. I mean, just having an inward look doesn't at all imply that wrongdoing was there or that people are acting
Yeah.
without the wrong intentions, or that the wrong thing was done. But it does mean that maybe we can be in a better state.
Yeah.
And I think we have to look inward on that. And that's the way that we're going to rise up. So I love it. Just quick 10-second blurb. What keeps you optimistic?
My favorite book since I was in high school French is Voltaire's Candide. And it's about optimism, but also not about optimism. It's about kind of going back and forth between the two. I mean, the reality is that I think of that often. It ends with, we need to cultivate our own garden. And I sit here lucky to be at a place like Brown University to every day talk to incredible students, to teach on public health and global health and health history. And I see how much energy and excitement and passion they have for this moment and how curious and open they are to doing things differently. That's what keeps me optimistic.
Well said. Well said. Thank you again for being with us.
Thanks so much for having me.
And thank you to all our listeners for tuning in for this episode of Northwell Health's 20-Minute Health Talk.